Hi, Medical Wildcats. I'm Joseph Guggenheim. I'm a 1972 alum of Northwestern University Medical School. And today's presentation is called The Old Lady on Harrison Street. It will be a history of Cook County Hospital. And I took the title from a book written by one of our emeritus professors of surgery, Dr. John Raffensperger, who wrote a definitive book on the history of Cook County Hospital. So this will be a two-part presentation with, we'll cover the first century today and then cover the next 100 years next month. Next, please. The Cook County Hospital and the institutions for care for the indigent have had several locations in the Chicago area since the first permanent settlement in the early 19th century. Next. The first Center for Medical Care was at Fort Dearborn. This was a trading post set up by the U.S. Army at the Chicago River and Lake Michigan. The first recorded surgical procedure in this area was bilateral leg amputation performed in 1832. Next. The next facility was the Almshouse, and this was located at the intersection of Randolph and Clark, begun in 1832. It was on a public square, and it was really a isolation center for communicable diseases, isolating patients with cholera, malaria, smallpox, typhoid fever, and scarlet fever. It was staffed by the physicians from Rush Medical School, which was chartered in 1837, actually a few months before the city of Chicago was chartered the same year. Next. The next facility was the Tippecanoe Hall at Kinsey and State. This was originally a warehouse and became the first general hospital in the Chicago area, and it was known as the first Cook County Hospital. It too was staffed by Rush physicians. It was later replaced by 12 rented beds at a hotel near the current Tribune Tower, the Lake House Hotel. Next. This was followed by Mercy Hospital, which was established by the Sisters of Mercy nuns. It was Chicago's first private hospital. It was set up in conjunction with the Rush by the nuns and Dr. Daniel Brainard. Dr. Brainard was the founder and president of Rush Medical School. The county paid the nuns $3 a day per patient for care for the indigent. Next. During the Civil War, patients were moved out west to 6500 West Irving Park to the township of Jefferson. They were cared for there from 1863 until the end of the Civil War. Next. A city hospital was opened in 1854. This was originally a cholera hospital in an old frame house. It was demolished and replaced by a 130-bed brick hospital in 1857, as seen in the picture. It was plagued by political problems. It sat vacant for 2 years because the city would not purchase furniture or medical supplies. It too was staffed by Rush physicians for teaching medical students. It was occupied by the government during the Civil War. Next. After the Civil War, it became a county hospital due to the efforts of two of the staff physicians, Dr. George Ammerman and Dr. Joseph Ross, who got themselves elected to the County Board of Commissioners. They pushed this to be a county hospital. The first internship in the United States was established here in 1866. At first, it was a 12-month unpaid position, and then it became an 18-month position. The building at first was said to have good heating, lighting, and ventilation, but then corruption and graft in the county government set in, and there was a lack of funds for medical care. So the building began to deteriorate, and there was poor sanitation with roaches, rats, and overcrowding. The overcrowding was partially relieved by opening a south wing, increasing the bed count to 220. Next. One of the early physicians in these hospitals was Dr. Edmund Andrews, who was one of the 5 physicians who left Rush in a disagreement with Dr. Daniel Brainard over the entrance requirements and the curriculum for a medical school. They left and became the founders, along with some of their colleagues, a group of 12, to open the Chicago Medical College, which later became Northwestern Medical School. He was the first professor of surgery at Chicago Medical. He later became a trustee of the Northwestern University. He was a pioneer in several areas. He visited Lister in 1866 and learned about carbolic acid for antisepsis. He was a Renaissance man, inventing a urethroskop for removing stones. He invented a brace for spinal deformities, and it was said to be an expert on geology and glacial history of North America, writing on those subjects. Also a musician, and he built an organ. Next. Many strides were made in medical education at these institutions. As I said, the first internship in the United States was set up at the county hospital in 1866. This was an unpaid position, originally 12 months in length, followed by lengthening it to 18 months. The final 6 months was similar to a chief resident or junior attending. It was an unpaid position. The interns and attending staff took a competitive exam to be on the staff, and Northwestern or Chicago Medical College graduates consistently did well on the exam, better than the graduates from the surrounding schools. Beginning in 1866, the staff was drawn evenly from Rush, Chicago Medical College, and appointees from the county. Next. The county purchased a block on the west side, close to the current location, at Harrison, Polk, Wood, and Wolcott Streets, and built this multi-building red brick complex. The neighbors objected to the relocation of the facility to their neighborhood because they thought it was going to be a source of contagion. The red brick buildings were designed by John Cochrane, who designed the state capitol in Springfield. The bed capacity reached 2,000 in 1909, and the staff was drawn equally from Rush, Chicago Medical College, and from outside physicians. Next. There were pavilions consisting of 14 wards, each housing patients in a large room, and this is a photograph from one of the wards. There was a separate ward for the erysipelas patients, a skin infection. There were 4 medical and 7 surgical wards with 30 to 50 patients per ward. The surgical amphitheater could hold 60 or 600 observers for surgery, and church services were held there on Sundays. Next. But the medical strides were not made by the buildings per se, but instead by the prominent physicians on the staff at the hospital. Next. One of the early prominent physicians was Dr. Christian Finger, who was both a pathologist and a surgeon. He immigrated from Denmark to join the staff. Many of his interns became some of America's most prominent doctors. He had to borrow $1,000 to buy his appointment to the hospital. He began the use of rubber gloves for surgery and also changing his clothes and shoes out of his street clothes for surgery. He became professor and chairman at Chicago Medical College. Next. Dr. Nicholas Sen was another prominent doctor. He was a graduate of Chicago Medical College. He was from Switzerland, and he obtained a second MD degree from the University of Munich. He was head of the surgery department at Rush. He was the first editor-in-chief of the periodical Surgery, Gynecology, and Obstetrics, which later became the Journal of the American College of Surgeons. He was elected to the American Medical Association presidency in 1897 and did research on pancreatitis, head and neck surgery. There's also a surgical retractor named after him. Next. In 1886, he did research on penetrating wounds to the abdomen. He did this by inflating hydrogen gas per rectum in dogs and then igniting it. He used hydrogen because it was easily obtained, it was inexpensive, non-toxic, and it would emit a blue flame after being ignited. He inflated himself with 6 liters of hydrogen to see what it would feel like, but he did not ignite it. And this method was used in military medicine to detect intestinal perforations until it was later replaced by radiography. Next. He stressed the importance of first aid and frequently quoted the German surgeon Friedrich von Esmark saying, "The fate of the wounded rests with the one who applies the first dressing." Next. Dr. John B. Murphy was also on the staff and became professor and chairman at Chicago Medical College. He was a professor, he was a pioneer in vascular and thoracic surgery. He was reputed to have done the first femoral artery and vein repair after a gunshot wound. He operated on appendicitis before McBurney. He was President Roosevelt's personal physician. He published a series of periodicals called the Clinics of John B. Murphy, MD, which later became the W.B. Saunders publication, Surgery Clinics of North America. Next. There's a memorial to him very close to the current site of the Feinberg School of Medicine at 50 East Erie Street, inspired by a building from Paris. The building was designed by Marshall and Fox, the architectural firm which designed the Drake Hotel and several of the luxury apartments in the Gold Coast and on East Lakeshore Drive. It is still used as an auditorium and event venue and owned by the American College of Surgeons, which previously had their headquarters adjacent to this site, but the headquarters have now moved. But this site is still owned by the American College of Surgeons. Next. There were several prominent Black doctors on the staff at Cook County Hospital. Dr. Daniel Hale Williams is said to have performed the first successful heart surgery. He trained and taught at Chicago Medical College. He repaired a stab wound to the heart in 1893. The patient walked out of the hospital after successful surgery and lived for another 20 years. He was the first Black surgeon admitted to the American College of Surgeons. He was said to have said, people who don't make provisions for their own sick and suffering are not worthy of civilization. Next. Dr. Austin Maurice Curtis was another prominent Black surgeon. He was the first Black surgeon on the staff at Cook County. He was also a graduate of Chicago Medical College. He became professor of surgery at Howard University in Washington, D.C. He was known to have said, "The diagnosis must depend upon the preponderance of symptoms." Next. Dr. Herrick made significant contributions during his tenure as staff at Cook County Hospital. He identified sickle cell disease as a genetic disease affecting Blacks manifested by sickle-shaped red blood cells. He found this in a man from Grenada, Black man from Grenada, who was in Chicago studying the dentistry. He and his intern published their findings in 1910. Herrick also correctly speculated that heart attacks are caused by clots in the heart's blood vessels, and was the first to advocate EKGs for diagnosing heart attacks. Next. But this period was a dark period in the hospital's history. In 1882, the county dismissed Dr. Edward Lee, a physician who was doing research on xenografts for skin coverage of wounds. Nearly the entire academic staff resigned for 23 years, and the county replaced them with homeopathic and eclectic physicians, and also sold staff appointments. And this is a picture of the hospital in about 1900. Next. The county decided that they needed a new facility, and in 1910 concluded that the hospital was overcrowded and unsanitary. So they passed a bond issue for a 3,500 bed hospital, later to become the largest hospital in the United States. The county board hired William Hollibird from the architectural firm of Hollibird and Roach as the architect. Hollibird was the architect for Soldier Field, the Palmer House Hotel, and the Hilton Hotel and Towers on South Michigan Avenue. Hollibird was soon replaced by Paul Gerhardt Sr., shown in this pixelated picture from the Chicago Sun-Times. Next. Gerhardt was a German immigrant, and he had many German clients. His tenure as the county architect was complicated by nepotism and self-profiting. He married a daughter of one of the Chicago board members and was suspected of making a profit from the doors that were going to be installed in his proposed Cook County Hospital. He was the county architect from 1910 until 1913 when he was dismissed. He designed several warehouses, hotels, and schools in the Chicago area, and some of the schools are still standing. Next. Gerhardt designed a 10-story building extending 600 feet along Harrison Avenue, but was fired in 1913 and replaced by Richard Schmidt. Gerhardt later became the Chicago Board of Education architect, where he designed several of the Chicago schools. His plan was downsized a little. The building was shortened to 550 feet and lowered to 8 stories instead of 10, but most of Gerhardt's plans were kept. The building opened in 1912, but was not completely finished until 1916. Next. The building is done in a classical revival style in the Beaux-Arts tradition. This is how a lot of Americans wanted their public buildings done in the early 20th century. The building style is seen in many banks, universities, museums, hospitals, and hotels. It was considered modern in function, but traditional in design. Next. The building had the typical style of many skyscrapers with a 2-story base, 5-story shaft, and a 1-story top. Next. The building had extensive ornamentation on the north side, the Harrison Avenue side. You can see lions and rams around the oval windows, Ionic columns, and cherubs on the facade. Next. This building was considered state-of-the-art. This was the ultimate hospital at the time. It had a daycare and a schoolroom. There were summer concerts on the grounds. The Chicago Public Library opened a branch, and in occupational therapy, patients were taught wood carving and weaving. Patients could stay as long as they needed. So if they needed long-term care, they could get it at this institution. So this was considered state-of-the-art in the early 20th century. It was beset with problems in the next 100 years, and we will discuss that next month. Next. So I'd like to thank 2 of our emeritus professors of surgery for their contributions to this lecture, Dr. Yao and Dr. Raffensperger for the text and some of the pictures, and especially Dr. Raffensperger for allowing me to use the name from his book, The Old Lady on Harrison Street. So stay safe, stay connected, and let's get together virtually again next month. Thank you.